Since late last December, the North Carolina Department of Health and Human Services reports there have been at least 23 confirmed measles cases across the state, with more than a dozen of these cases involving patients 17 or younger. Health officials say children and teenagers are most vulnerable to transmitting this extremely contagious virus.
What makes it more dangerous is kids are contagious before they really start to develop some of these symptoms with a high fever, cough, and what makes it a little bit more distinct is it typically has red eyes.
Dr. Soren Johnson, a Novant Health pediatrician, describes measles as one of the most contagious airborne viruses. In response to this uptick in cases, NCDHHS hosting a live discussion panel tonight. Dr. Andrew Grine, an Advent Health medical official, says vaccines have been pivotal in prevention efforts.
Vaccines have reduced many diseases that have killed or severely disabled people just a couple of generations ago. Up until recently, we hadn't really even talked about measles that much because measles was one of those diseases that had really kind of gone away.
Health experts stress that after initial exposure, measles symptoms often appear 7 to 14 days later. Dr. Grind says certain symptoms calls for immediate treatment.
In the case of emergency care, if your child is having trouble breathing, is unusually low energy, crying without making tears, most seriously, blue color around the mouth. It's important that they be seen by somebody right away.
North Carolina is one of 26 states dealing with measles infections, which Dr. Johnson says is raising serious medical concerns.
We start to have local people who are not picking up measles from traveling to, some foreign country or wherever, but they're getting it in our local community. So you can get vaccinated as early as 6 months. That's not advised across the whole state. That's just in the outbreak areas.
Health officials warn that measles could still be spreading across Buncombe County and the Charlotte metropolitan area. Locations, they say, appear to be more susceptible to person-to-person spread following the state's most recently verified cases.